It is a sub-regional day-long forum aimed at discussing strategies to combat HIV/AIDS by 2030.
If you look at the theme, I think it's very important because the response in big demographies and in small demographies will not be the same.
The convergence, coordinated by Enda Center, brought together members across the region to discuss challenges and share information on cross-border experiences on HIV/AIDS. Speaking at the forum, the Executive Director, National AIDS Secretariat, Usman Baji, stressed the need for concerted efforts in the fight against HIV/AIDS.
Governments cannot do it alone in the global response to HIV and AIDS. And so you needed to come up with some very innovative mechanisms that can help address the vulnerabilities relating to HIV and AIDS, particularly as it relates to cross-border and key population in the West and Central African region. We are grateful to have the support of the government of Luxembourg over the years, who have been very instrumental in keeping this particular platform very active over the years.
Ngui Saleh Turpin, an official from Enda Center, and Dr. Fatima Tadiba, Assistant Director of Health Services, both called on stakeholders to scale up efforts to end HIV/AIDS by 2030.
The FEV Impulse Regional Project, also known as Borders and Vulnerabilities to HIV and AIDS, has been supported for more than 15 years by the government of the Grand Duchy of Luxembourg and coordinated at regional level by Enda Santé.
We continue to make efforts in not just fighting out the reason, in not just figuring out the reasons behind such gaps and challenges, but the ministry continues to be committed to support and pioneer all programs and policies geared towards responding to HIV/AIDS.
Tanya Martins of Luxembourg Development Aid said the fight against communicable diseases is one of the major priorities of the health component of the Luxembourg strategy to achieve sustainable development goals.
At a time when external public aid funding is being decreasing, Luxembourg continues to maintain its level of official development assistance at around 1% of its gross national income, keeping international solidarity, particularly in public health issues, as high priority in its development strategy. Luxembourg engagement towards the HIV response remains strong in view of the fact that AIDS is not over. It is one of the deadliest pandemics of modern times. Evidence based on UNAIDS report shows that approximately 1.5 million new HIV infections were reached and 38.4 million people were living with HIV in 2021. It is therefore critical to maintain efforts unabated.
At the end of the day-long exercise, officials are expected to map out a way forward for a concerted approach towards ending HIV/AIDS by 2030. Marian Jai Ajayi, GRTS News.